During the pandemic, those folks with heart issues still need to make sure they're getting care that could be life-saving. I am joined by Dr. Jeffrey Walden with Consulting Cardiologists to make sure that people get some good information about this. Thank you so much for being with us, Doctor.
Sure. Thank you for having me.
You know, you're concerned because you think maybe too many people are staying home, and you're finding that that can be a health risk all on its own if they're not getting seen, right?
Correct. Yes. There is a concern across the country with cardiologists that we're not seeing the same amount of people as ill in the hospital as we used to see. And this includes during flu times and non-flu time. And there's a concern that people are staying home and actually waiting out their symptoms and potentially injuring themselves at home. Initially was a local concern in the Hartford region, but then articles were published nationally that we are wondering where the cardiac patients are. And it's still not well understood, but the concern that I would have and that a lot of my colleagues have is that people are not seeking the care that they need because of fears about the environment in the ER and the potential other exposures they can have.
Right, and we have done numerous ER interviews letting people know that there is a process, and I know you want to make that point that if something really is an emergency situation with your heart, you are not at risk. It is safe to go to the ER. Is that correct?
Yeah, that's very correct. The ER has a very good system set up to segregate those who potentially have COVID, who are concerned about COVID. And we have a system set up that if we have a cardiac issue that we're sending someone in for, that they will be triaged differently and expedited the way it always has been. So it is a safe endeavor to head to the hospital for the appropriate reasons.
And also, it may not be something that you need to go to the ER for. You want to let folks know your offices are open for heart-related issues. And is that for existing patients and also folks who maybe think they just need to be seen?
Yes. Our goal really is to help supplement the cardiac care in the region. We are trying to keep people from heading to the hospital unnecessarily, which would be patients that are established with us or those who want to be established with us. We would interview someone over the phone to determine the appropriateness of the care. Sometimes we'll direct them straight to the emergency room because this is something that can only be handled with rapid assessments and rapid turnaround time for testing. Other things can easily be handled in the office, and then we can figure out the exact time and place. We would take into consideration someone's risk factors. If someone's 80 years old, we may want to slow down the workup. If it's something that sounds like it can wait and not risk any kind of exposure. But there are other things that happen, and heart issues are just by nature unpredictable and could be very devastating. So what we like to do is have the opportunity to speak to people and make sure that we know what's going on. I can't help someone if we don't know what's happening to them.
Right. And I know I've done many stories where often women, the symptoms are subtle to begin with. Even without a pandemic, they often don't get seen as much as they should. So what do you want to say to people who are listening about if you're having certain feelings, what really needs to get checked out?
Yeah, any symptoms that are sudden, acute, and severe should really be considered to be evaluated in the emergency room. EMS can provide a phenomenal initial form of assessment for cardiac issues, and a lot of the most important information can be gathered at someone's house by EMS. So don't shy away from engaging with them. If it's a condition that is severe with like pressure in the chest, breathing problems, you feel ill, you feel like something's happening, that has to be seen. And sitting on it, trying to tough it out is not a good idea any time of day. But even with this current environment, it's best handled in a hospital. If you have an established relationship with a cardiologist, give them a call. We have systems set up to triage this very efficiently and get answers to you very quickly.
And I know you're doing telemedicine. We've got some questions on the feed about how is that effective for heart care? Do you feel like you can still give good care with a video conference?
Yeah, actually, I'm very excited about telemedicine. It's a very interesting addition to what we do. Actually grateful to the federal government for opening up telemedicine to the communities, and they had a lot of restrictions that were going on. And once those restrictions were lifted, we were able to offer telemedicine to everyone. And it's a wonderful tool to have. You can meet someone in their house. You could see the support system. I can have someone obtain a blood pressure. I've actually had patients run up and down stairs for me to see how short of breath they are. If they're savvy with their cameras, we can see if they have any kind of ankle swelling. That sometimes is a challenge to get the video cameras set up right. But in general, we can do a very good assessment based on just interview, discussion. Clearly, you miss out on exam, EKG, and an accurate blood pressure done in the office. But a lot can be done and a lot can be learned about from someone's care by just talking to them.
I have a question from the feed from Leslie who says, do PVCs put you at risk for a poor outlook if you get COVID?
Well, PVCs in general are harmless arrhythmia in the category of arrhythmias. You always want to question if you're feeling PVCs or if they're another form of skips, and those have to be identified by a monitor. So the initial idea of a PVC, I'd want to make sure that's an accurate diagnosis. But in general, that's not really considered a serious cardiac condition and wouldn't put you at increased risk for any kind of viral issues.
What about just the extra stress that everyone is under because of this? Is that causing a bigger problem with heart disease?
Well, I got to be honest. When I initially started off in practice, I wasn't sure stress had as much of an impact on the human body. But as I've been doing this for many years, and really almost 2 decades, I'm very impressed with the impact of stress on total health and especially heart health. I mean, it really can be internalized. And I believe we really are underestimating the impact of stress during this pandemic on the global health of our communities. We're seeing an unprecedented amount of death and concern, and I believe this will have a long-standing impact on people.
How are you advising your patients to stay healthy? I know that we can't do what we used to do, but I imagine exercise and eating correctly and trying to get sleep is even more important for your heart patients right now.
Yeah, very true. I've been happily surprised during a lot of my telephone and telemonitoring interviews that a lot of people have lost weight. I was shocked by that. I would actually think the opposite. But they all say the same thing, which is they're eating out less and they're seeing their weight go down. And it is a lesson about our society and our habits. But if, say, coronavirus is something that's inevitable and someone's going to get 6 months from now, 8 months from now, or even a month from now, you just want to be your healthiest to fight it. And a lot of it can be achieved now. You have a lot under your control, and you need to take control over what you have the ability to handle, and that's exercise, sleeping right, having appropriate diet, and taking advantage of this time to do some self-care, self-hygiene, so that you can actually, when or if this ever happens to you, you're going to be in a good fighting shape to handle it.
And what about people who are already in the system? What do you want to say to them about not rescheduling their visits right now?
Well, typically, and this is not just in cardiology, but in all of healthcare, it works at a maximum speed. And so if you wanted to find a physician who was available anytime in the past, they were always booked up for weeks or months. Nowadays, with telemedicine, there's a lag in people interacting with their physicians. So now it's a really good time if you want to get in touch with your doctor to reach out. I've done it for my own family members.
Yeah.
And instead of waiting 6 months for a visit, they now are speaking to the physician in a day. And the availability is there. So I would suggest to people they take advantage of this time to interact, update your physicians, talk to your team that is in charge of your care so that everything is up to speed, medications are understood, side effects are known. I will tell you that in a few months, when things start to get back to our high-speed level of care and healthcare, it's going to be hard to get in again. So I would, gently suggest that people interact as scheduled or ahead of schedule, so that you don't get caught up in really a surge of healthcare issues down the road.
Someone else is asking, should EKGs be used at home for a virtual visit? I don't know that most people have those or how you do that.
Well, it's available. It's an app on some of the phones. The iPhone and the Android have an app you can purchase For about $90 or $100, you can get the ability to do your own single lead electrocardiogram, or the newer ones, you can get a few of the 12 leads. It's a wonderful tool, and we do suggest it, and we do use it in certain circumstances. It's something that is a fun device to have as a cardiologist, because now at home, we have the ability to obtain a lot of vitals. We can get a blood pressure. We can have people use pulse oximeters for their oxygen content, and now we can actually get a single lead ECG. It's a lot of power and tools available now to have at people's fingertips.
What would you say to people who are having some heart pain, but they're scared to come in?
I would say, if we don't know what's going on, we can't help you. And the better thing to do is call, speak to someone, speak to either your primary care doctor. It's always a good starting point. If you have a relationship with a cardiologist, give them a call. If you're having a serious heart problem and you're sitting on it, you're potentially damaging yourself actively. And so it'd be much better to let someone make a decision if that symptom needs instant evaluation or if it's something that can wait. But I would just caution people about making decisions on their own.
Yeah, and I want to just use this time to educate folks, because we've certainly done lots of stories where people ignore symptoms. I've interviewed people who've ignored them for months, if not years, and sometimes they think, oh, I guess men tend to be better about it. They'll feel a pain in their heart area and they go, okay, I need to get checked out. But especially with women, sometimes gastro issues going on, some reflux, really extreme fatigue for no reason. Those are things that could be signs they really need to be seen, right?
Very true, and well put. I do think women are tougher than men. We see this in many different forms within medicine. After open heart surgery, men seem to complain more. Women really can tough it out pretty well. I do think that their pain tolerance is different, and I do think they will minimize symptoms more. So my only plea is, don't sit on symptoms. If you're concerned, share them with someone, and then let us figure this out, because you can really harm yourself if you decide to try to self-diagnose.
Now, I know that you were actually trained at NYU in New York City, and now you're here. I know you've got colleagues in New York City. We seem to be getting compared a lot to New York on a political level, but healthcare-wise, it's been at crisis point there. How are we comparing?
Well, I when I trained at Bellevue Hospital, NYU, it was the height of the AIDS epidemic, and it was a very challenging time. And some of the similar findings that you see in the ER, the intensity level, the serious illness, the level of disease leading to intubation and respiratory issues, was very, very similar to the HIV/AIDS epidemic. So this feels very similar. It was chaos back then. Any given day in a New York City hospital is chaos. But if you add in a pandemic on top of that, it is really a difficult environment. My hat's off to the colleagues down there for handling a very high density population with a very, very serious illness. In Connecticut, it's different. Our ERs are not what you see on TV in New York. There is room to be seen. People can be treated very quickly and expertly, and you're not going to be sitting in hallways. Right now, the ERs are not at capacity. So if you think you're sick and you want to be seen and you're unsure, get seen. Don't rely on the images of the New York City hospitals to think it's everywhere, because it's not.
Not right. And we have done daily interviews with Hartford Healthcare just talking about exactly what you've said. They have a very good system for keeping COVID patients separated, but also in many areas, the need to see doctors or the number of people coming in is fewer. So you actually have a better shot of getting some individual attention and being seen faster right now, right?
That's correct. And the cardiac teams are set up and ready to go. They usually are multiple teams working at the same time, and they are ready and willing to help. My hat's off to Hartford Healthcare. They have done a phenomenal job with all their hospitals and the way they handle the ERs, and then all the higher level of care outside of the ER. It's a very impressive process to be watching.
And Doctor, what about the impact that COVID is having on the heart? Do we know anything about that yet?
It's still, it's still not well understood. I just got to be quite honest. I've been following this since the information's been coming out of China, and this has been a big challenge to figure out why those with heart issues have a higher morbidity and mortality with this virus, and it's just not well understood. There are some direct impacts of the virus on the heart, but that does not seem to be of epidemic proportions right now. It really seems to be this is a true respiratory virus with some minor cardiac irritations along the way. So we're not seeing a deluge of heart attacks from this virus.
It might also be a good time just to make sure that you're being really healthy. And if you haven't seen your doctor, to get that workup, or at least get some, you can still get blood tests done. You can still do virtual health. So with everyone having more time on their hands, it's a good time to take good care of ourselves, right?
Oh, yeah, very much agree. I think as the weather allows, it is time to get outside and exercise, and then really look towards 4 to 5 days a week of aerobic activity, really get the heart pumping, get going, and improve your overall health. If you're not going to do it now, when are you going to do it?
Speaking of exercise, what should we be doing as far as our heart? What do we need to do to keep our heart healthy?
Yeah, I tend to advise about 30 minutes, about 4 or 5 days a week of anything that gets the heart pumping. I would not suggest a particular tool or device, because if you hate it, you're not going to do it. So find what you love and start working on it, and then do it. If it's the first time, do it for 10 minutes, and then come back tomorrow for another 10 minutes. But then just build up. Go to 15 minutes, go to 20 minutes, move it up to 30 minutes. Challenge yourself to just do a little bit more each and every time, and whatever it is, it will pay off.
A lot of questions, of course, that everyone has is when we think this will be over. Nobody really knows that question. Nobody knows the answer to that at this point. But are you seeing a light at the end of the tunnel?
Yeah, today I became very optimistic. If you look at the Hartford Hospital statistics and the Connecticut statistics, we really are at a plateau phase with the concept of improving over the next few days to few weeks. So I really feel that there's a real optimism in the state that we're going to be on the tail end pretty soon. There's some treatments that Dr. Fauci was talking about that have some real promise, and he seems optimistic. And I think that we're starting to see the beginning of research starting to pay off. So it's a time to be optimistic. You got to be cautious. You got to prevent yourself from getting this. But I think it's time to really see that we can get into a better place. And in a few months, we really will look back at this as just a dark time that's passed, and we've moved on with lives, adjusted, but we've moved on.
Now, the other thing that people need to know is that your office is available 24/7. So if you're having heart issues, you don't know if you should be seen or not, just making that phone call means that someone can help you determine what your needs are. Is that right?
Yeah, I always laugh over that because when I trained in New York City, we were always called all the time, 24 hours a day. The New Yorkers really just called their doctors all the time. Yeah. I remember being called because someone didn't know which kind of soup to eat, and he was choosing between leek and potato soup and an onion soup, and he called the on-call doctor to ask. And that was not unusual in New York City. Here, no one seems to really call their physicians at night. And if there are issues, call. We're open 24/7. All physicians have on-call coverage, and we're available for any issues. And if you're ill, we want to know what's going on with you.
So while people are listening, because you might have some new potential patients that are wondering what they should do, what's the best way to get in contact? Because you guys have offices all over the state. Yes.
We have 9 offices. We're 13 physicians, and later this year we'll be adding a 14th physician. There's one phone number to call, 860-522-0604. That's our main line number. We have staff able to take any information and get you on board and get you going with the practice.
So if those folks who are maybe just joining us, I am speaking with Consulting Cardiologists. And Doctor, thank you so much for being with us, because we want everyone to know that if you are having some heart pain and or any kind of symptoms, this is not the time to put it off. We know we're in a pandemic, but you could be risking your life in other ways. I get this question a lot, even from people when they know that I'm interviewing a doctor like you, and they say, how do you know if it's just a panic attack or if it's a heart problem?
It's hard to, I'll tell you, as I've done this over the years, I really stopped blaming panic. I really think that's a diagnosis of exclusion. You really got to be sure about it. So I
Okay.
would rather have someone come in and investigate it in the office or on telemonitoring before you blame panic. I find that that is something that is a diagnosis I've been shying away from over the years because I really do think people are feeling things. If it's happened suddenly and comes out of nowhere, then why is it panic? Maybe we should look into the heart as a potential cause of
And,
those symptoms.
and if nothing else, there are a bunch of tests that you can take and you can rule things out. Would you still be able to get those tests right now? The stress tests and the blood tests, can that happen right now?
Yes, we like to, for preventing the spread of the virus and for patient safety and staff safety, we're trying to minimize the interaction in the office. But if symptoms sound concerning, we are for sure open for stress testing and all the cardiac tests, ultrasounds, monitors. We're ready and willing to do it. It's just we will have a little extra level of screening about the timing of those procedures.
All right, thank you so much. We're speaking with Dr. Jeffrey Walden. We appreciate everyone who's asked the questions on the feed. And of course, if you think someone needs to know this information, feel free to share it at home on your Facebook page. But we appreciate Consulting Cardiologists being with us and for being out there and letting people know that you're still available to help. Thank you so much.
Thank you very much. I appreciate it. Thanks for your time.